Hello and welcome to another Why the Long Face shortcut.
This week we're talking about bipolar depression.
Which is quite a misunderstood malady. We're normally having a beer or two, but it's Sunday. Paul's a bit delicate, but I'm going to have a little can. Here we go.
Oh, cheeky.
Little cheeky can.
Yeah.
There we go.
But is it kind of the hard stuff? Or?
No, it's not. It's Morrison's Cloudy Lemonade. We might
You're
get
so
sponsorship
rock and
from
roll.
Morrison's. Morrison's is probably the best supermarket, and this Cloudy Lemonade comes in at about $1.25 for 6. It's delicious.
Bargain. Well, you can get what you pay for, though. You can tell.
It's lovely. It's really nice.
Really?
Yeah, it's diet. It's lemony, and no, it's quality. It's absolute quality.
It doesn't taste of chemicals.
I do tend to get a bit of a headache.
You get it
afterwards. Bright lights in my peripheral vision, but it's apart from that, it's all right.
It's like metallic taste on the tongue.
Slight metallic taste, slight monsterism. Remember when Bart was in The Simpsons? Was a experimenter for soft drinks. The experimenter just looked at him and went, "Pleasant aftertaste, slight monsterism."
Monsterism.
The Simpsons. So, maybe you want to crack the can on what we're discussing today.
Okay, so we're talking about depression, but depression is part of the bipolar.
What? Really?
Manic, or what used to be called manic depression, right?
Are you saying that it's all one thing and it's just the symptoms of bipolar are you get high as well as low?
I think there's no reliable way to tell the difference between someone who comes along with symptoms of depression that might distinguish between just depression or depression that's part of a bipolar disorder. Especially if it's your first ever episode, you're not going to know if that high is around the corner. But that's the thing, isn't it, that distinguishes between depression or recurrent depression and bipolar disorder, which is usually recurrent episodes of depression and mania. But I think the whole picture's changing because of research into briefer episodes of elevated mood, hyperactivity and so on that characterise mania or hypomania, less severe mania, which doesn't necessarily have such a detrimental effect on how you function.
So mania, that sounds like a vaguely Victorian terms. Is it something that's still used?
Yeah, very much so.
And what does it characterise
DSM-5,
by?
ICD-10, everything. So, classic mania, you have elevated mood, disproportionate to the situation, hyperactive, loads more energy, feeling like you're driven by a motor.
So basically an actress.
Yeah, or you after you've had 10 espressos.
Got it.
Except you'd be a lot more irritable and grumpy. Although that is your default setting these days, isn't it?
Irritable, yes. Over 50. Everyone's a twat.
His irritability
I wouldn't be so irritated.
goes up to 11.
Well, people weren't such idiots.
Yes, it's the world's fault, isn't it?
Yeah.
Yeah.
Finally.
Yeah. Finally someone understands.
But I don't think he really understands. So, thoughts racing quickly, lots of ideas,
continue.
that kind of thing?
Racing thoughts.
Yeah.
And less need for sleep because you've got bundles of energy. You don't need sleep.
Right.
And in its most extreme forms, you may not sleep at all. Be up all night.
For how long?
Sometimes for a week.
No
sometimes
way.
For 2. Yeah.
Jesus. Does that have a detrimental effect on your health?
It does. If you the less you sleep, the more manic you get. I think in the early stages, it's like a warning sign if you're not sleeping as much.
A stupid question. If you're manic, I guess it's hard to understand sometimes that there is a problem because it feels good to have all these ideas flowing through you.
Yeah, that's right. You've probably got less insight in a manic or even mild manic state than you do if you're depressed, because it's a kind of, I'm full of all these great ideas, and why can't everyone see the value in these ideas? It's a feeling of impatience. Why can't you keep up? Yeah. So now I'm going to talk over you, and I know what you're thinking even before you say it, and that kind of thing.
These are fairly irritating people, then. Or they can be. Do they tend to be highly intelligent people, or is that not necessarily a factor?
No.
Really?
No, that's not predictive.
Wow, that's interesting. So anybody, is it more prevalent in any particular race,
demographic,
class, gender?
Oh, right. It's equal between the genders.
Right.
Pretty much the prevalence of bipolar, and it you probably do see a bit more of it in the lower socioeconomic demographic, because people drift down perhaps into that into that level of functioning.
Is
You know
that
what I
because
mean?
mental illness often affects people in low socioeconomic groups?
Yeah, in
because their
general.
life's harder in a way.
Well, it's partly it has been shown it's partly because their life's harder, but it's also been shown that there is a drift effect as well. So, for example, if it's not your first episode that you're presenting with, you've probably already your lifestyle's already been affected by your illness, your occupational level, and so on.
I mean, you can socially drift downwards just based on your illness.
Yeah, if you don't get help early enough. I mean, let's be honest about it. You know, it does affect your functioning, doesn't it? I mean, being depressed or high. So there are other things on the list of symptoms, like things like grandiosity, feeling that you have special gifts or powers, which can reach delusional intensity.
Were you ever diagnosed?
Like the Messiah complex? No, not at all.
Not even during that period where
I
you
am just the best psychiatrist in the world.
You went around saying that you were Hannibal and you were going to take elephants over Clapham Common.
Oh, that. Yes, we weren't going to talk about that.
Oh, sorry, I thought it was no holds barred. No, I see.
No.
Do you sort of grand schemes as well? Great plans that people have?
I think one psychiatrist said on, I think I saw on a YouTube video, it's basically just like being on a crack mission.
Very nice.
There are a lot of similarities between someone who's intoxicated with a stimulant and being manic.
Right.
It's probably the best way to understand it.
Right. Do you think the similar mechanisms are going on in the brain?
A similar sort of overdrive that's going on. The problem is, of course, that usually things that go up must come down again. So often, if you can prevent the manic episodes, then you'll prevent the crushing lows that not inevitably, but usually come after a high.
Right.
So you might, as a punter, go along for help when you're low, and unless you tell the doctor that you've had a high, he may just assume that you just need an antidepressant, because it's a box standard depressive illness.
So if you're on a low, but you are bipolar, is it a different treatment from a standard depressive presentation?
Yeah, I think you've got to be absolutely wary aware of the fact that if you prescribe someone with bipolar disorder with an antidepressant alone, then there is a risk of that causing a switch into a manic state.
So you do, obviously, stupid question, but you do, as someone presents with depressive symptoms, you do say, do you have periods of elation? Do you have periods where you don't sleep at all? And massive bouts of creativity, blah, blah, blah?
Well, you should, but it's very easy for doctors to forget to ask those questions when someone is just predominantly coming to you feeling low. And often people forget when they've had episodes of feeling high, actually. It comes down to what we were saying before about sometimes lacking insight into the fact you're high, especially if it's a milder form, hypomania. And if you have a history of depressive episodes and hypomanic episodes, that puts you in a different kind of category. That makes you bipolar 2 rather than bipolar 1, so different categories of it. And bipolar 2 is classically missed because the highs are more subtle. They may not have affected you to the extent that you were hospitalised or even that you had to give up a job. Or in many cases, that hypomanic phase can be very, very productive, especially if you work in the creative industries where you're starting to make lots of creative connections between things and you're energised.
So you don't just come up with bad, crazy, for want of a better word, I shouldn't use the word crazy, but you know what I mean, crazy ideas. You can actually be part of a period of great creativity.
And or just productivity.
And productivity, right.
Whatever job you're doing, you get the job done probably twice as fast. So mild mania can make you more productive, but as you get higher and higher and get into full-blown manic episode, you become less productive because then you find it much more difficult to focus on what you're doing. Your mind becomes way too distractible.
Is there any
flying off in different directions?
Delusion as well, which says this is brilliant, this is the best, this is the most crazy, wonderful thing in the world, and actually it's not.
So that's what comes along with that, as we said before about the whole Messiah thing. But that brings us nicely on to Stephen Fry, who is my depressive hero of the week.
Depressive hero of the week. And
sufferer of bipolar disorder, although he will openly admit his depressive episodes are more handicapping for him than the highs.
Would most bipolar people think that, do you think?
No.
Right, interesting.
Right. So, and the great thing about his series of documentaries in 2006 The Secret Life of a Manic Depressive, parts 1 and 2, is that he allows himself to be filmed in a state of mild mania, I guess, where he's happy and buying 12 iPods and sort of overspending a bit, but he can afford to, and generally he's more creative and stimulated and so on.
Kind of brave of him.
But very brave to be filmed and to allow that to be broadcast. He also allowed himself to be filmed when he was on the other side of that, when he was depressed. But he was responsible enough to also interview people, and often quite famous celebrities like Carrie Fisher, who suffered more serious manic episodes and had ended up hospitalised as a result of them. So, but much respect to the guy for coming out and talking about his mental illness and saying that he is a man who is at the mercy of his moods.
So here's a funny thing. When you look at Stephen Fry, I think we both admire him. He's funny as hell, and obviously quite bright and a novelist as well. Does your opinion of him diminish in any way, knowing that he is a sufferer from a fairly serious mental illness?
No, you just think he's more of a hero in a way, don't you? And
I agree,
it makes him more interesting.
Well, that's an interesting point.
Yeah,
it does.
And you wonder if he'd have achieved as much in his life as he has done if he hadn't had the condition as well, in a way.
Yeah, exactly. So in some ways, it helped him. That's right. I think the really important point is that it doesn't diminish a person.
No.
The fact that they suffer from a serious mental health issue, and them coming out and being honest about it actually does the opposite.
Yeah, but he's also though quite clear on the responsibility of the sufferer to get some help. So he'll say that he needs to take medication to help moderate his moods. He didn't used to, and he used to prefer not to, but I think overall he's now on the side of medication. As a psychiatrist, I'm not in the position to tell people what to do with regard to medication, unless, of course, they're in a strange situation of taking away someone's liberty to protect themselves or other people. But most of the time you wouldn't be in that position. So it would be just a kind of negotiation, really.
Well, as a psychiatrist, you've always been, as far as I can remember, someone who wants to do the best thing for the patient.
Well,
and you don't exclude the possibility of a long-term medical regime.
Well, there've been patients who've decided not to take medication, and I've thought, well, I can't obviously insist on it, there's been no point in destroying the therapeutic relationship I have with this individual, this person in front of me, who I feel might suffer more as a result of that decision. Let's maintain this relationship, because hopefully at some point we'll be able to work together to try and minimise the complications of these mood swings.
And it's interesting with Stephen Fry, you think he must have considered before he allowed himself to be filmed in a sort of manic state or even in a depressed state, is this going to make me look bad, or is this going to make me not as popular anymore? He must have crossed his mind, and of course it's almost certainly done the opposite. It's very interesting to watch.
Maybe it's easier to. Yeah, I suppose it's always a brave decision. He's a hero for doing it, and I don't think he has been diminished in anyone's mind.
No, or anyone who matters.
Yeah,
frankly.
Yeah.
The other thing, just finally, my last thought on it is, he's clearly manic when you see him on TV, but he's still him.
Hey,
he's
not all the time.
No, sorry, in his documentary I'm talking about.
Oh, in certain parts of the documentary. Yeah,
he's clearly manic.
Yeah,
and yet it's still him. And if you were his brother or his cousin or his husband, you'd still love him. It's still Stephen Fry. He's just in a strange zone that he's probably best out of. But it's not as if he's mad or frightening or crazy or looks like he's about to do something dangerous. He's just,
There's Stephen Fry who's a bit high.
Right. Nice to meet you.
Yeah. And there's Stephen Fry who's a bit low too, who's also been on our TV screens when he's been in that very low state, but you wouldn't actually necessarily know it.
Well, we talk about the mask, don't we, in other episodes, and how people become adept at being actors, at playing not a different character, but playing themselves as an okay person when they're far from okay. And it's quite a talent, and it's an exhausting one at that.
He describes how he was comparing the show QI, and he was very, very low at that point, but still able to perform because he's a consummate professional and so on. But all the time he was cracking jokes to the audience, he had a little inner voice going, "You're a cunt, you're a cunt, you're a cunt." I'm using the C word because I'm quoting.
You sure it wasn't Alan Davis? No, it's terrible, isn't it? Amazing. And there's no correlation between what your inner voice is telling you and what you actually are.
Yeah. Well, he was able to get halfway through a West End show, wasn't he, in 1995, and he suddenly disappeared off. He couldn't actually maintain the pretense any longer.
Yeah.
He was in a depressive episode. It wasn't until 2012 when he did actually take an overdose with vodka, when he was filming a show about anti-gay campaigners in Russia and Uganda, and he was in Uganda at the time.
I remember that show.
His producer found him convulsing, having taken this huge overdose.
Wow.
Saved his life.
Yeah.
Amazing. But anyway, and brave enough to tell a story about that too.
A very, very definite hero of the week. Excellent choice, Dr. Paul.
Hey, thanks for joining us on Why the Long Face. As ever, we're here to inform, hopefully, and entertain, but we're not here to give you medical advice. There is, however, information on our website, ytlf.com, that's whytlf.com, about where to get help. See you next time.